Hello, and welcome to today's Sports and Exercise Medical Sciences Bachelor's Taster Session. Thank you very much for joining us. My name is Catherine Nicholson, and I'm a current Sports and Exercise Medical Science student and your chair this afternoon. We are hoping this taster session will address those course-specific questions you may have and will help you to gain an insight into what it really is like studying on our course. So this afternoon, our speaker, Dr. Flaminia Ronca, will introduce you to some of the great science and modules that you will learn as a SEMS student here at UCL. Dr. Ronca will also provide a summary of the SEMS program, and there will be a Q&A session for the second part of the event. So we're here to respond to your questions, so please share those thoughts using the Q&A function on Zoom. This session is being recorded and will be made available on our website following today's event. Now, to introduce our speaker, we have Dr. Flaminia Ronca. Dr. Ronca is an associate professor with a PhD in exercise physiology and biomechanics, and she's a researcher at the Institute of Sports and Exercise Health, and is a program lead of the undergraduate programs in SEMS taught at the ICH with the University College of London. Over to you, Dr. Ronca. Thank you.
Thank you very much, Catherine. Hello everyone. Thank you very much for joining. I'm going to share my screen, so hopefully you can see that. And I've got a couple of slides to share with you. What I would like to do is give you a bit of an overview of what it's like to study as part of this program at UCL. We will give you some examples of student projects and the type of teaching style that happens at the ISCH on this course. So, welcome to the BSc in Sport and Exercise Medical Sciences. And I think what's important to remember throughout this talk is that this degree is specific in medical sciences rather than sport and exercise performance alone. So while we do cover performance, we cover elite sport, but there's also a very strong emphasis on medical sciences, which we will go through. So we'll give you some example of student research projects that have been going on at UCL throughout the years. And the reason why I use this for the talk is because I think it gives a very nice overview of the types of things you will learn, but also the types of projects that you get to do in your third year. As part of your degree, you do a research project in year three, and these are some examples of things that we have learned with our students. And then we will talk about the different modules that you study on the degree throughout the 3 years and how that sets you up for a profession in sport, if that's what you want to do. So, one important aspect, as I said, to remember, this is bridging medical sciences, sports sciences, and scientific research through your project. Everything we do is evidence-based. And there is a strong difference between pure sports science, physiotherapy, and sport and exercise medical sciences, which is what we do here at UCL. So, I will start with sports science because you might be more familiar with that. Typically, if you went to study sports science alone, you would focus on performance, you would focus on healthy people, biomechanics, coaching, a bit of physiology, a bit of psychology, a bit of sports analysis, and so on. So, all very much focused on healthy individuals and athletes and how to get sporty people faster and stronger and fitter and performing better. What you would do in this course is on top of the performance aspect, you would first of all study how to apply principles of physical activity in the general population. So we have a very strong focus in clinical populations. You learn all about different aspects of health and in disease, how the body works in health and in disease, and how to apply physical activity for example, a patient who suffers from cancer or heart disease or a woman going through pregnancy or through menopause. So, how do we apply physical activity in those contexts is one of the things that we teach is not taught in sports science degrees. So, that's one key difference. And we also focus very much on athlete injuries and rehabilitation. So if you study sports science alone, you don't get a clinical grounding and you don't study how injuries happen and how to rehabilitate and manage injuries. Sports science does not teach that. In this degree, you would study how an injury happens, how to assess it, how to prevent it, and how to get that athlete rehabilitated and back onto the pitch and playing so that they don't get injured again. So that's another key difference in medical sciences and sport. And the third thing, if you are considering physiotherapy, so lots of students come to us saying, I want to become a sports physiotherapist. And many of our students do end up in that field. And what they do is they do our degree, which is a 3 year degree in sports, and then they do a 2 year degree in a master's degree in physiotherapy. So then they become an accredited physiotherapist with a strong grounding in sport and in athletes to be able to go into sports physiotherapy. If you studied physiotherapy as an undergraduate degree, you would get a very strong clinical background on the nervous system, on the musculoskeletal system, and how they work, especially in disease. You would be taught how to assess injuries of all types, so not specific to sports, but just say neuromuscular issues, for example. You would not be taught any of those applications in sport or how to rehabilitate a sport injury. You would not be taught on how to design a training program for an athlete. Physiotherapy does not teach that in an undergraduate degree. It's very focused on clinical populations of all sorts. So that's sort of very important thing to consider. So if you want to work with lots of different types of populations that have lots of different types of neuromuscular issues, from children to the elderly, then physiotherapy is the path for you. If you want to work in sports physiotherapy, you need a combination of the two. So and you can do it either way. What many of our students is they do sports, the undergraduate degree, and then they do a master's degree in physiotherapy. And the third thing to say that I don't have on this slide is many of our students then go into medicine. So they do the undergraduate degree in sport and exercise medical sciences, and then they do a graduate medicine degree afterwards. So that's also a possibility. Okay, so research project. So these are some of the members of staff on the team who teach you. And what I like to show, apart from the lovely smiles, is that we have a interdisciplinary background. So we have sports cardiology, women's health, strength and conditioning, physiotherapy, nutrition, and neuroscience. So you are taught by a team of staff who have expertise in different areas. And in addition to this team who are focused on sports, there's also a team of clinicians and scientists that teach other modules across your degree. These are a couple of pictures of our students in the lab doing everything from strength testing over here, VO2 max testing, so cardiopulmonary testing, and some brain imaging over here. And again, just a similar picture. So this is a VO2 max test. Some of you might be familiar with this concept. This mask measures gas exchange, and by measuring the gases that we breathe in and out, so oxygen and carbon dioxide, we learn a lot about a person's body at a mechanistic level. So what their metabolism is doing, are they producing lactate? Are they burning fats or carbs? And how fit or unfit is that person? And we can use this information in athletes. So we can do a VO2 max test to see how fit a person is, and we can design a training program for the athlete that is specific to their level. Or we can use the same type of test in a clinical group to predict risk of mortality in an operation, for example. So if a person with a heart disease has to undergo an operation, we can do this test and we can determine if they are fit enough to undergo surgery. So it's got lots of applications. And we like to scan people's brains while we do this as well, which is quite fun. So lots of neuroscience happens at the ISCH, which is always fun. And I guess that leads me on to part of the talk, which is my field and the bit I'm passionate about. So a bit of a taster session here. We are trying to see if we can measure the brain during exercise. So this is me a couple of years ago. This is functional near infrared spectroscopy. And what this does is it shines light into the skull. And based on the color of the blood that is flowing in the skull, we know whether there is metabolic activity happening in different regions of the brain. So this is one of the things that our students have been working on. And to give you an example, here we have a student being tested. So their brain is being measured during a VO2 max test at different levels of VO2 max. And we want to see if we can measure brain activity in different regions of the brain during exercise. We have found, this is some data from a student project from years ago, which has been published. And what we did is we trained our participants for 2 times 6 weeks. And we brought them back into the lab after the 12-week training program, and we found changes in brain activity in the participants who underwent the intervention. So making people fitter improved their response to exercise at a brain perspective, which is a really positive message to give. Okay. We do similar things in children. So this is Evie, who recently finished her PhD. And again, this is a project that we did in collaboration with undergraduate students, where she compared fun exercise versus boring exercise in children. So we had children running around the lab and also being monitored on the treadmill. And she scanned their brains before and after the two different types of exercise. And what she found was that exercise that was fun actually engaged the brain more than exercise that was boring. And the children made fewer errors on a task of inhibition and attention after the fun exercise. So that tells us that something that is engaging, like a sports session that children enjoy, actually enables their brain to switch on a little bit more and control their behaviors afterwards, which is a very positive application of the type of research that we do at UCL. Now, all of this was done in the lab, and of course, when you go into the real world, there are so many different things that influence what happens. There's so many different variables that influence these outcomes. Our life is full of complexities. So we have gone into schools, so still thinking about children and public health, and we did an intervention in schools trying to reduce sitting time. So I'm sure that you've been going through several months of studying lately, and you probably spend quite a lot of time sitting at your desk, and the day becomes very long. It's hard to concentrate and pay attention after a long day. So we taught the teachers to give active breaks to children and get them to stand up and move around at different times during the lesson and to integrate exercise or movement within lessons. And one of the first things that we found, if you look at these graphs over here, you can see the blue blob is higher than the yellow blob in the intervention group. And what this is telling us is that the children in the intervention group lost weight. So we had a reduction in obesity purely by reducing the amount of time that the children spent sitting down at school. So there's another nice message here where if you break up the day by standing up a little bit more and walking around, that can have a significant health benefit in children and in adults. There are studies that do that in adults as well. So speaking of adults, Dr. Kate Ratley is a colleague at the ISCH, and she is a physiologist, and she's very passionate about female health, menopause, the menstrual cycle, and she does lots of research around female physiology, metabolism, and ventilation. So she's very interested in asthma, COPD, breathing difficulties, and what hormonal changes do to our physiology, our metabolism, and our pulmonary function. So she involves lots of students in her research as well. Lots of fun things happening in the lab with Kate. So here's an example. You're probably familiar with this already. Speaking of the menstrual cycle, this is what happens over the 28 days of a menstrual cycle. Lots of hormones going up and down. Estrogen is one of them. It peaks in the middle of the cycle and it raises again afterwards. And then we have progesterone, which peaks at the end of the cycle. And these hormones have lots of effects on the female body. Men also have fluctuations in hormonal levels, not in the same way that women do. It's more over a 24-hour period, but there are cycles that are studied in males as well. And these hormones have effect on our metabolism and on our brain. So in this case, estrogen can have an excitatory effect on our brain. So it makes our reaction times faster. Progesterone has an inhibitory effect on the cerebral cortex, which means that it makes reaction times slower. It doesn't change people's intelligence, it doesn't change their ability to make decisions, but it does mean that the brain becomes faster and slower sometimes in line with our hormonal levels. And this is from a student project again, or a collaboration with students we did a few years ago, which made the news headlines, where we showed that during ovulation, so just after estrogen has peaked, we definitely see faster reaction times, especially in athletes. And we see slower reaction times in the luteal phase, which is again where we have higher progesterone as opposed to higher estrogen. So these are some fun things that we're exploring with students. But I think the more interesting thing that's coming out of this research, if you focus on the right side of the screen here, when we did another study where we asked women who were menstruating at different phases of their cycle how they felt. So this is showing that on days of menstruation, women reported feeling worse and they reported having more symptoms. So they had headaches and brain fog and irritability, and so just things that make us put us in a bad mood. And when we asked them if they thought that their cycle was affecting, oh, sorry, when we asked them if they thought that their cycle was affecting their cognitive performance, most of them said that they thought that they were doing worse. And what you actually see on this side of the slide, so I'm sorry it's not very clear, it's missing some boxes, but I want to draw your attention to ovulation. And what you see is that the line in the middle of the box is lower than the lines in the other phases. Lower is good, so lower means lower, faster reaction times and fewer errors. And what this is showing us is that reaction times and errors were better during ovulation. They were performing better, which is interesting. But the more interesting bit is that there was no detriment to cognition during menstruation. So if you see here, it's very obvious that the box for cognitive symptoms is a lot higher. So they have worse symptoms during menstruation, but the box for cognitive changes is not higher. It's no different to the other boxes. So that's telling us that their perception when they say that they're not feeling very well actually does not translate to a change in cognitive performance. So that they're doing just fine on the cognitive tests, which is very positive. And another positive message that we have from the same study is when we split the women in the study by their activity level. So we have women who were sedentary or inactive, did not do any sports in red, compared to women who are more active in the other colors. If you're observant, you will notice if you look at the red arrows, the women who are not doing sports, the boxes are consistently higher than all the other boxes, regardless of the menstrual phase that they're in. So, what this tells us is that being sedentary, so not being active, not doing sports, has a detrimental effect on our cognitive performance, which is far more important than the menstrual cycle phase that we're in. So the message is that our lifestyle, which is something that's within our control, matters a lot more for our brain than something like our menstrual cycle phase, which I think is an important public health message. So these are the types of things that are coming out of our student projects. Switching completely to a different topic, here we have nutrition. So this is research that my colleague Tarun has done in the past, and he's interested in supplementation, in this case, tart cherry juice, which we know has antioxidant effects. He studied the effects of tart cherry juice on fat metabolism and on blood pressure, and he found that supplementation over only 7 days reduced blood pressure and improved fat metabolism. So there's a nice story there to recommend friends to take some tart cherry juice if they need to burn more fats and reduce their blood pressure. Here's a different example of supplementation with spirulina and with algae. So some of our colleagues are looking at these supplements that you may have heard of and whether they improve cardiovascular function as well. So that's when we've done other things with creatine, with caffeine, with guarana, so other stimulants, and we're potentially looking at some microbiome, so probiotic supplementation for future studies. And one study I'm very excited about is with chocolate, which is something we will do in a couple of months. So if you join us, we will be doing a study on the effects of chocolate supplementation, which should be fun. So moving away from nutrition, here's another example of some research that Tarun has done with table tennis. So thinking about performance, and you can kind of see here he's wearing a mask. He was interested in understanding whether putting ice on our body, which is something many of us would really appreciate right now with today's weather, whether that can reduce our perception of heat or reduce heat in the body and therefore improve performance. He did find a small improvement in performance using neck cooling. And what was really interesting with what he did, a couple of months later, the Olympic Games happened, and the Japanese team, you could see them putting ice on their necks because they had read Tarun's research and they thought that this would help them in their Olympic competition in table tennis, which was really nice. So again, real world research and moving outside of things that you will be doing in the lab and seeing it happen in the real world is normally quite exciting. Here we have a completely different study. So again, moving out of the lab using wearable devices. You might have an Apple Watch or a Garmin or a Fitbit. We use these quite a lot in our research at UCL. And this is a study that we did with students a while ago, looking at their movement patterns throughout the day and how they felt in the morning and the evening. And what I'm showing you here is the activity level of university students who self-report as early morning types. So if you are an early morning person, this might be what your movement patterns look like. They're very active in the morning and then they kind of come down and calm down throughout the day. This is what that same data looks like if you put one line for every student in this group. So this is average data over a group of students. Here we have our early intermediate types. Then we have our neutral type. So if you say, well, I'm neither an early morning person, I'm not a night person, I'm a bit of both, this is what your patterns might look like. Here we have our late night students. So if you're a night owl, you prefer to go for your training in the evening. So we've got students exercising at 8 p.m. And then we have our extreme late night chronotypes in brown down here. And these are, if you pay attention, the line is a lot lower than all the other lines in the graph. And what this tells us is that students who are very late night chronotypes seem to be less active throughout the entire day compared to everybody else. So we looked at this data another way, and we looked at the total area under the curve of activity levels of students in the different groups. And we found quite consistently that late night students had lower activity levels than earlier groups or all the other groups. So we've done an intervention. We're currently doing an intervention at UCL to try to shift students' chronotypes to the morning. You get a free Garmin. We give you some exercises. We connect you with a student union, and we find ways of supporting students to become a bit more active. So there's a lot of fun stuff that's coming out of that study as well. And it looks like we're managing to shift students' chronotypes towards being early morning, which is very exciting. And we've learned a lot from that study, and we've started applying what we're learning with students to emergency workers. So we just finished a very large study which involved lots of undergraduate students on our course, working with police, nurses, firefighters, and chefs, and understanding what their lifestyle looks like, especially because some of these individuals work night shifts and working at night can be incredibly detrimental for our mental and physical health. So we spent 2 years collecting glucose monitor data with Garmin watches. So we get heart rate and movement throughout the day. And then we sent cognitive tests on the phone and some questionnaires every day for 2 weeks to our participants to understand what their life looked like. Um, so I don't have any outputs to show you here, but what we're finding some very interesting relationships between the food that the participant eats and how that influences their stress levels. One thing I can definitely tell you that we're finding is eating a high sugar, high carb meal at night is very bad for your health. You get a very high level of stress while you're sleeping, even though you might not feel it. Drinking alcohol at night is horrendous for your physiological stress. Again, you might feel that you're sleeping better if you have a glass of wine or a pint of beer, but actually your body is not doing very well. And we're learning a lot more about circadian rhythms, nutritional patterns, stress, and social interactions as well. So, if you're interested in the psychology of exercise and physical activity and how exercising with others can help our mental health, these are things that we're finding quite a lot in our research. So I hope that gives you a rough overview of lots of different things that we do at the ICH and possibilities. There is lots of research happening in strength and conditioning, rehabilitation, and physiotherapy as well. So we have Paul and Joe, who are two colleagues who are very interested in rehabilitation after injury. So we have some studies there looking at different techniques and methods to improve injury rehabilitation. This is one example. We've got a study here looking at resistance elastic bands. You may have seen these in the gym. You might use them yourself. And this graph is showing the pattern of muscle activation when using different resistance bands at different speeds and how this changes throughout the range of motion. So there are some more strength and conditioning focused studies that our students do as well. Okay, so hopefully that gives a bit of an overview on what types of projects you could do. And now I will switch and talk to you about the program structure and what do you learn throughout the first 3 years that leads you to be able to develop your own project. So, in green, we each of these is a module, and each of these little boxes represents 3 months of study. So, in year one, you study cardiovascular function, pulmonary function, muscles, anatomy, so how the body works essentially in health and in disease. In year two, you develop that information. You start to learn how to design training programs to make people stronger. And then in year three, you go into sports optimization. So, how do we make those small marginal gains with supplementation, with cherry juice, with creatine, with or psychological strategies or sleep strategies? What can we do to improve our performance? You have a series of modules that focus on functional anatomy, inflammation, repair, the nervous system, and then biomechanics and injury assessment, which is fantastic, very practical module. So this is what I mentioned earlier, where we prepare you to learn how an injury happens, how to prevent it. If a person does get injured, how do you assess that injury through functional imaging and through practical assessment? So actually moving a person's knee around, and Catherine can tell you all about her experience on that module. And then if a person is injured, how do you rehabilitate it, get that person back on the pitch and training? So this is something that you would not study in physiotherapy and that you would not study in sports science at undergraduate level. Then we have, if you're interested in nutrition and in drugs, you study the gut, the liver, the kidneys, hormones, etc., nutrition and metabolism, pharmacology, and sports nutrition as an optional module in year three. If you're interested in neuroscience and psychology, you also get a series of modules around behavior change, sports psychology, neuroscience, and we have this exercise medicine module at the very end, which is one of the best modules that we get lots of very good feedback on, looking where every week you look at a different clinical population, how to apply physical activity in that group. And then you have your research project. So throughout year one and two, we help you understand how to develop basic data handling and statistical skills. And in year three, you get quite a big chunk of time in developing your own research project. And finally, a very, very important module to mention is the work experience module that you do in year three, where in throughout term one of year three, we expect you to accrue 80 hours of work experience. We help you find those placements. You can find your own if you would prefer, but we have some options. and we support you in developing your professional skills through that module. So several of these are optional modules: the exercise neuroscience, sports optimization, work experience, and sports nutrition. These are optional modules that you can pick a couple from these. So we're very keen on making sure that our graduates have the practical skills to be able to go into the workplace, and that you are set up so that you're confident, knowledgeable, and ready to take up a job and do well. So on that note, what will you know? You will learn how to work independently in a lab. We expect you to be very practical, very hands-on, and present in the lab. We will teach you how to assess injuries. We will teach you how to develop a strength and conditioning program for healthy people. We will also teach you how to prescribe exercise for patients and for clinical populations. We will teach you how to think critically, solve problems. We do problem-based learning, which is always very well received, where students are given a case study and you have to work together to solve that problem. And we expect to teach students through what we call the connected curriculum, which is where students join staff on the research journey. So we are exploring together and learning together through scientific research. What does a day in the life of a student look like at UCL in the program? There are the big lecture theaters, so you will have, the university experience where you're on a room with everybody else. But we also do a lot of small group teaching, and we do some practical applications, like I said, problem-based learning, where you work through things together. Lots of lab testing, so you will be testing each other in the lab and having a lot of fun. We do help you develop presentation skills. So there are what we call formative assessments, where you do, for example, a practice trial at presenting something, but the mark doesn't actually go towards your degree. It's a way of developing that skill and gaining confidence, because as you can see here, some of our students eventually end up in international conferences and they present their work with professors from other countries. So we're always very proud of our students when they attend these sessions. In terms of assessments, you will have exams like everybody else. There's the essays and oral assessments and whatnot, but you will also be assessed more creatively. So we might ask you to make a video, or we might ask you to write a blog, for example. We have our own conference every year. So the ISEH holds an international conference on sports medicine. Students are always invited to attend, and you usually get free tickets for that. And that's a repeated slide. Okay, finally, career options. If you do pick this degree, where can you end up? What types of jobs can you do? You can end up in elite sports, so you will have the skills to develop a training program, for example, for an athlete to make them faster and stronger, or analyze their performance and support them. But you could also work with clinical populations. So some of our students end up working with clinical groups or in hospitals. You can work in exercise medicine, prescribing exercise for specific clinical groups, such as the elderly or children or cancer patients and so on. Some of our students end up doing further studies in public health and understanding how do we apply things to change policy to inform government in making changes to make the population healthier. You can stay in academia, become a professor. You can work in industry, startups. Some of our students work with devices like startups developing tech. So there's technology in sports, there's a nutrition in sports. Some of our students are working in the supplementation industry. So there's quite a lot that you can do. And finally, vocational degree. So if you want to become a physiotherapist, you can do that with 2 years of a master's degree after this degree. If you decide that you want to go into medicine, you can do a graduate medicine degree, which is 4 years after this degree. So, and lots of our students do that as well. You will be based mainly on the main campus. So this is our beautiful UCL building. So please, if you can come to London, definitely come to the open days. This is the medical school library, which is, so both of these are historic buildings. and the Royal Free Hospital in Hampstead. And then this is the Institute of Sport, where you'll do all your practical teaching. This is a bit of an old slide, but a bit of a brag. We are consistently top 10 in the world, but if you're applying to UCL, you probably know this already. We do incredibly well, specifically in medicine. So we rank top 10 in the world for medicine, which feeds into the medical sciences degree that you would be studying if you decided to come to us. Our institute within UCL is a collaborative institute, so it's a consortium of multiple organizations. And what this means for students is that there's access to opportunities for jobs once you graduate. And hopefully, this is what you look like 3 years after you start. And we have a lovely graduation ceremony every year in the summer. So, if you do decide to pick this, you would be merging, hopefully, a passion for physical activity, whether that's at low level or elite level, doesn't matter, and merging that with medical sciences and scientific research. So that concludes my talk. And if you have any questions, these are two emails that you would be very welcome to contact. And I think that is my cue to hand over to Catherine to see if there are any questions.
Yeah, so feel free to drop in the questions. As they're not for now, I'll just talk a bit about my student experience. So, as Dr. Ronka previously mentioned, the SEMS department at UCL does have amazing connections. And so that directly does benefit, like students can benefit from it. For example, for my research project, I was in collaboration with researchers worldwide. I looked into the consequences of concussions. And I think that also, apart from the science, you get to learn how to collaborate with international teams, which is a skill that you will need in a lot of fields in this day and age. So I think that was very beneficial. I also, as part of my work placement, worked with basketball and football teams. And there you really realize how rewarding this degree really is because all these strategies, optimization strategies you're implementing into the athletes' plans, you can really see how they benefit from it, the teams and the coaches, and so that's something very rewarding. So we have a question here of what are the requirements for this degree?
So requirements for the degree, if I remember correctly, is AAB in biology, sorry, math and another science, so biology, chemistry, physics. They are advertised on the website, so I want to make sure I'm saying the correct information. But if you have any doubts, check the website. And depending on if you've done IBSC or A level and whatnot, there will be um, specific requirements or specific notes for each one of those. The one thing to bear in mind is you definitely need to have done a science. So biology is a must, and one other science.
Yeah, I'd also like to say that a lot of people that join this degree, they come from different backgrounds, have done different programs at school, and that's why the first year is really helpful because it really covers all the topics from the foundation of medicine. You look at organ systems, different pathways. So even if you're not very confident, let's say in biology, and you hadn't studied it in high school, UCL, this degree does provide a good foundation so that you don't get lost, and yeah, you're very well supported. Yes. Are there any other questions, maybe? Would you consider physical education alongside biology as a replacement for chemistry, physics, or maths?
Not as a standard offer. There are occasions where a conditional a conditional offer can be made in some cases. So there is, Kate has put the requirements in the chat. I'd recommend going and looking at that website to make sure you meet the requirements. And you can always email the admissions team if you have specific questions on if your degree deviates from the subjects that we list there.
Also, I would like to add that our course, it is First year, it merges a lot of different programs, so you do get to know a lot of people. And as you go along, it becomes more small, and so that really allows for the professors to actually help you one-on-one. And if you have any questions, they're always welcoming. They always have extra time for you, and that's one of the advantages that comes with having a smaller cohort. A lot of modules are very hands-on, which is a strong point of like a strong benefit of this module because sports medicine is not just about memorizing concepts from a textbook, it's actually applying them. And so for sports optimization, so the cherry juice study, we were actually able to participate and we were the participants ourselves. So we actually drank the cherry juice and then performed the exercise. We had to run on the treadmill, and that was very fun. So we have another question. How often are the exams?
I think you're in a better place to answer that one, Catherine.
Yeah, so the exams, so the in-class exams, so written, are usually at the end of the year, and we usually have one per module. Now, we also have a lot of presentations and a few scientific essays that come throughout the year. They're usually very well spaced out, so it's not a worry of cramming everything into one specific week. It's very well spaced out, so yeah, it accommodates to students and them having other priorities, which we all do. So, yeah.
So unless there are other questions, maybe some. I just want to congratulate Catherine. She has done a fantastic job on her dissertation, which she presented last week and has recently submitted. So you mentioned earlier, focus on concussion. Uh, and what was interesting about your dissertation is that your interest, even though you've done a fantastic systematic review, so you've been very systematic, but you see that applying in industry than in academia. And I wonder if you want to comment on that translation between what you learn in pure research and how that can be translated into a job working in industry afterwards.
Yeah, so I looked at the psychological outcomes of concussions in American football players, and that is a topic that has been gathered a lot of attention recently. It's an ever-evolving sport, and it was something that was actually not really looked into. And I found that football participation does actually increase the risk of depression, anxiety in players. And so the research that I've conducted actually has very strong implications for legislations and laws, and looking at how we should actually have clinical strategies put in place to reduce the exposure of these football players to these potential long-term psychological outcomes. Also, actually, something in the research is that a lot of the players that do get concussed actually forget that they get concussed and so don't actually report it to clinicians. So that's another issue that we have. And we should really look into how we can implement strategies to stop that from being a main problem. Um, if there are no more questions, we can wrap up here. So before we go, we would really appreciate your feedback on today's session. So please take a moment to complete our short survey, which will appear in your browser at the end of the event. If you'd like to meet us in person and explore our campus, don't forget to sign up for our upcoming events and open days on the 26th and 27th of June. You can find full details and register via our website. And if you have any further questions following today's session, please do reach out to us on UniBuddy, and we would love to be happy to help. And thank you all for your engagement, comments, and questions today. And a special thank you to Dr. Flaminia Ronca for delivering such an excellent session. Have a great evening, everyone. Thank you.